For derm, I would say duct tape.
Oh,
Good to have some duct tape around.
that's a good one.
For
yeah.
warts. Welcome back to part 2 of DC Dermatology Skin Truths featuring board-certified pediatrician Dr. Mailinh. Welcome back.
Thank you. I'm excited to be here.
We're going to be diving into your frequently asked questions, and she'll be answering one of them, and I'll be answering it as well. All right, so let's get started. What would be your top gift recommendation for a baby shower gift?
Ooh, really good question. I would say, thinking back to when I was a young mom, a really great booger sucker. Okay. Ooh. A nasal aspirator.
Yes.
And some saline. That's one of my favorite products, and a really good diaper rash cream.
Which nose sucking device? Sounds so weird saying it out loud.
I know.
Which one do you recommend? Because I'm okay saying the brands.
Yeah. Okay. Well, for my personal experience, back in the day, my children are both teenagers now, but the Nose Frida, still a very popular product. It's a nasal aspirator that you use your mouth to suction, but there's a trap, so it'll never go in your mouth, but it gives you good suction. Good old-fashioned bulb suction, those are harder to find on the market to be soft enough, but if you can get it from your pediatrician's office or the hospital, those are great. And nowadays, there's a slew of electric-powered aspirators. To be honest, I haven't used any of those myself, but the good old-fashioned Nose Frida and some good saline saves the day a lot of the time.
Absolutely. Whoever invented that, they're probably so rich.
Seriously, right?
I wish I knew something like that. For me, I would recommend 2 things. Sun protective clothing, because it's not really on people's baby shower gift list often.
Yeah.
And if you really want to splurge, you can get different sizes, because the kids grow, so you can get like
true.
a 6 to 9 month is nice, and then maybe sun protective clothing when they're like 1 or 2 years old. That's really great. Another thing is sunscreen. I think moms are really busy, so they're not thinking about sunscreen right away because they're in like the newborn phase. Mm-hmm. But I really love Blue Lizard. It's available at Costco in like a family pack. I think that, yes, it goes on thick. It's mineral. It goes on thick. You can see the white, but it does blend in after a couple minutes. And then
it's good to see the white, though,
exactly.
So you know exactly where you're hitting.
Absolutely.
Like when you're applying it for kids.
You'll know if you're going to miss a place.
Exactly.
And it stays on. So some of my friends are like, oh, I don't like Blue Lizard. It's like stays on so long. Well, that's the purpose of it, because if they're going to go to the beach or the pool, you don't want it to, rinse off that easily.
Exactly.
And I also like that the cap turns a different color.
Yes,
so
genius.
I love that.
Mm-hmm.
It just reminds you like, oh, there's UV. You need to do something. Don't just maybe reapply, or don't forget to apply it even when it's cloudy outside. I think a lot of times my son the other day was like, it's cloudy, mommy. I don't need to wear sunscreen. I'm like, no, look at the cap. It's turning, blue or pink. So I love that it has that cap.
Yes.
What's a current social media trend that has been dangerous for children?
Ooh, that's a really good question. I'm going to take a step back and say it's not just the trend, but it's the volume and the amount of time spent on social media. I think that's probably one of the most dangerous things for children nowadays, because of like active looping of videos and exposure for kids. But if we're talking about trends specifically, unfortunately, I've been seeing a lot of burns from microwaving these squishies, Neatos. That's a thing. So, yeah, let's not do that, please.
Yes.
Mm-hmm.
Thank you. I didn't even know that was a thing.
Yeah, plus it's so hard to find those Neatos nowadays. You don't want to mess them up.
For me, on a derm side, I think I agree with you about the social media. I think the teenagers and children are on it a lot. And so a lot of these marketing things for like anti-aging creams and anti-aging practices, they are influencing young
Yes.
like teenagers to be like, oh, I need to start using this for my wrinkles or whatever it is. So I think that's something that I don't think is great for kids.
Oh, absolutely. I'm seeing it, unfortunately, even younger than teens. I'm seeing 8, 9, 10-year-olds who are spending all their birthday money at Sephora buying acids and things that their skin absolutely does not need.
Agree.
So, yeah, we need to really refocus on basic healthy skincare for our kids and sun protection.
Yes, and be very cautious about the algorithm. Once you look up something on IG, it just keeps looping all this attention into that topic.
Absolutely. So what are, like, Dr. Dinh, what are good basic things that kids should be using on their skin?
It's going to be based on their age and whether or not they're going through puberty, because I see a lot of patients in my practice for acne, and this is, you know, we're seeing kids going through puberty at different times, a little bit earlier now, actually. Could be something with the endocrine disruptors of some sort.
Right.
But you know, usually the teenagers I see, it's because of acne. So if they have acne or even mild acne, starting with an over-the-counter, like salicylic acid is fine. If you're doing a face wash that you want something more gentle, glycolic acid is okay. But if you don't have any acne, there's no point in doing these things. And then if they want to start a prescription for, you know, just to help unclog the pores, I usually give a very low dose tretinoin or a version of adapalene. Adapalene now is actually available over the counter.
Yeah.
So that can be a little bit tricky, because if they start it too much or use it too often, it can irritate their skin, and then they're like, oh, I'm rashy now from it. So even these over-the-counter retinoid creams or lotions or gels, they are helpful for acne, but be careful with using them because it really can dry out the skin.
Absolutely. So come and find your pediatrician. We'll help guide you through that before you have to go see a dermatologist.
Yes. Usually by the time they see me, they have cystic acne or scarring where we have to be a little bit more aggressive, and that could include oral medications like antibiotics or maybe even isotretinoin.
Absolutely, yes. So as pediatricians, a lot of families aren't aware of this, but we take care of the skin so much with our pediatric patients, from the time they're babies with eczema and toddlerhood all the way through, you know, acne through their teen years or preteen years. And so touch base with your pediatrician. We're pretty well versed in that too.
Absolutely. What are some home remedies that you wish more parents knew about?
Ooh, I'm going to answer again. Saline, saline, saline. Saline is salt water, right? Ask your grandma, she'll tell you salt water kills everything. It's like nature's natural antibiotic for you. And so coughs and colds, you know, there's not a lot of great medications out there that will help with coughs and colds or get rid of them faster, but saline is helpful. So saline spray for the nose and suctioning, because babies and toddlers, they don't do a great job at cleaning out their airways, and that's where the viruses live and bacteria live. They live in the mucus in your nose. And so if we can clean that mucus out, get rid of where they're living, and disinfect that area, it won't drip down the back of the throat, causing cough all the time for kids too. So saline and suctioning, aspirating the nose 4 or 5 times a day through coughs and colds, one of my favorite natural remedies.
Great tip. Great tip. For derm, I would say duct tape.
Oh,
Good to have some duct tape around.
That's a good one.
For
yeah.
warts.
Yes.
So there was a study that was done where they did duct tape, you occlude the area and you leave it on for as long as you can, and the body will basically create an immune response and try to inflame the wart to help it go away. So this is a great thing to do, because warts can be so tricky to treat in the pediatric population, especially for the young ones, because when they're coming into the derm office, most parents are like, well, I want you to do something about my child's wart. That's why I'm here. We can freeze it, but it's very painful. The teenagers can tolerate it, but it's like these young kids, like 3-4 years old, you're traumatizing them to some degree with the liquid nitrogen. Sometimes they're okay with it, but a lot of times it's really difficult. So I really like the whole duct tape therapy. So I do implement that in the practice when patients when their parents come in with their kids about, you know, how to treat warts. My son actually had a wart on his hand, and I knew he was not going to be able to tolerate duct tape. So I'm sorry, liquid nitrogen. So we didn't even do it, but I did duct tape on it, and it did go away.
That's awesome.
So I really like duct tape. If you could get every parent to stop doing one thing tomorrow, what would it be?
I would say I would ask parents to stop allowing their kids to be alone with screen time. Yeah, especially younger children, because the amount of exposure to different materials is very compounding for children. And so setting time limits for screen time and being present to see what your children are being exposed to is super important nowadays.
Oh, absolutely. Absolutely. That's a great suggestion. For me, it would be for the parents to stop using Neosporin so frequently on any minor cuts and scrapes, because we are seeing, and it's been a trend for a while, that patients are developing allergic contact dermatitis to Neosporin, and it looks like a really bad infection when this happens. And I can name so many patients that had this type of reaction after a surgery or after just a little scrape that they put Neosporin on, and then all of a sudden a couple days later it just, you see these little blisters forming around that area. So that would be my thing, is to stop using Neosporin, please, on the cuts and scrapes. Vaseline is fine.
Vaseline or
Aquaphor is okay.
Aquaphor, right?
Exactly. Name one item you can't leave home without when it comes to traveling with your children.
Ooh, my kids love to get fevers when we travel. So I am, besides sunscreen, of course, I always have some ibuprofen or Tylenol with us, just in case.
Perfect. For me, my daughter is still in diapers, so I never leave home without Vaseline or Aquaphor. One, it's great for skin if the skin gets really dry or irritated, but also good for like preventing diaper rashes too. By the way, do you recommend any specific brand for diaper rash cream?
Ooh, we've been through so much. My daughter used to get horrid diaper rashes. We used to call her monkey butt. Poor thing.
Okay.
But I would say one of my favorites is Boudreaux's butt paste.
Yes.
Boudreaux's butt paste is,
same.
and particularly the all natural one, which has a higher percentage of aloe in it. It's very protective for the skin, very easy to apply. So I always tell families that when there's a diaper rash there, you want to apply diaper rash cream in such a thick layer that it looks like cake icing on their, on the areas of the rash, because that will provide the physical barrier that we need. And then what I like about the Boudreaux's butt paste, that all natural one, is the percentage of zinc isn't so high that it's hard to remove. Because when I used the extra strength one, it was so thick that I would end up peeling some of the skin off when the skin is sloughing due to the severe rash. And so I thought the lime green all natural Boudreaux's butt paste is one of my favorites. But if it's mild, just slap a ton of Vaseline or Aquaphor on that. That's good enough. Yeah, or
I agree.
A&D ointment.
Yeah.
Desitin, classic.
Yes.
Yeah.
We love butt paste at our house too.
You do? Yeah, I honestly still
we
keep
always
a
go
tube
through that.
around for cuts and scrapes because it's so great at healing the skin.
Yes.
Actually, I just saw recently on social media about a trend with using diaper rash cream for your face as a like a barrier healing, right? So I don't know. You might be seeing me with some butt paste soon.
Just be careful it doesn't clog your pores. But
Exactly.
yes, the zinc part is very helpful. Well, thank you so much for joining us today. I so appreciate it. We had a great time and I learned so much, and I know our listeners did too. Do you have any last minute tips for new moms?
Oh, really? Thank you. Well, first of all, thank you so much for having me here today. It's, like I said, it's one of my favorite things to do, is share how to take care of our kids. For new moms, I would say if you are struggling with breastfeeding, this is something that I went through myself and with many of my patients. Reach out for help with that. Touch base with your pediatrician. Many of us are very well versed in helping with transition of care with like nutrition for babies, with breastfeeding support in office. Many of us have experience with this and have training in this, so reach out for help with that. Another great tip is what I think just a real life tip is, when you are bringing home a newborn baby, there's just so much stress and so much work to be done, and the most important work for you to be doing as a new mom is to heal. And so when family and friends come to visit and they say, what can we do? Don't say nothing. Say, please bring a casserole. Come help me with some laundry. It would be great if you can help me with the dishes. People want to help. And so your family and friends want to help, but don't carry everything on your own shoulders. It takes a village to have a baby, to raise a baby, especially those first 2 weeks of life. So when your family and friends are coming through, get some help. I wish I had done that more.
Awesome. Thank you. I would say on a derm perspective, with newborns, they're going to get all sorts of funny looking rashes. So this is where your pediatrician is going to be so handy, because they've seen it all. So don't freak out. Just know that they've seen it all and it's going to be okay. Another thing is when their child's growing, you want to make sure you're being really diligent with sun protection. So sun protective clothing, using your sunscreen regularly on the kids, and just really teaching them that habit, because then they will carry that throughout their whole life.
Absolutely. Very,
All
very
right.
important.
Thank you so much for being here,
Thank
and thank
you.
you everybody for listening.
We appreciate you.
If you enjoyed today's episode, please subscribe, leave a review, and share the podcast with someone who might find it helpful. This podcast is intended for educational and informational purposes only. It is not meant to replace medical advice, diagnosis, or treatment from your own healthcare provider. For additional science-based dermatology information, visit aad.org. To learn more about our dermatology practice, visit www.dindermatology.com.